Welcome back to Paw Print, where every wag tells a story of love. You love your dog, you feed them, walk them, maybe even talk to them like family. But what if I told you there are 5 silent symptoms that, if ignored, could take them from you without warning? These signs often show up quietly: a change in breath, a strange color in their gums, a moment of weakness you chalk up to old age. But behind them may be life-threatening conditions that don't wait. In the next few minutes, I'll show you exactly what to look for and what most owners miss until it's too late. Because sometimes noticing one small detail is the difference between rushing to the vet and saying goodbye. Number 1, difficulty breathing. When every breath becomes a warning. You come home and notice your dog breathing faster than usual, not panting after a walk, but chest rising quickly even while lying still. Maybe their mouth is open and tongue out, and they're standing awkwardly, like they can't quite catch their breath. Don't wait. This isn't just getting old. It could be a sign of heart failure, fluid in the lungs, or even a severe allergic reaction. And in dogs, these things escalate fast. Place your hand on their ribs. Count the breaths in 15 seconds, then multiply by 4. Over 40 breaths per minute at rest. That's your signal. Call the vet now. Some older dogs also suffer from laryngeal paralysis, where the throat doesn't open properly during breathing. In these cases, a simple surgery could save their life. Breathing is the one function we take for granted until it's threatened. And your dog can't tell you, "I can't breathe," but their body will. And just when you think this is the worst sign to watch for, there's one even quieter and far easier to miss. Number 2, pale gums, the silent red flag. Most dog owners check food, fur, and energy, but very few ever check the gums. And yet that's where some of the most dangerous warning signs appear first. Lift your dog's lip gently. Healthy gums should be bubblegum pink. But if they look pale white, bluish, or gray, something is seriously wrong. These colors could mean internal bleeding shock or even heart failure. And if your dog also seems weak cold or uninterested in food, you may be running out of time. Here's what to do. Press your finger gently against the gum. The spot should turn white, then pink again within 2 seconds. If not, head to the emergency vet immediately. Gums are like the dashboard lights in a car. You may not feel anything wrong yet, but your body is warning you something's failing under the hood. And sadly, many pet parents don't find out until it's too late. But there's another sign even more alarming: when your dog can no longer stand or suddenly collapses to the floor. Number 3, collapse or sudden weakness. When the body gives out. 1 minute, your dog is walking fine. The next, their legs buckle. Maybe they stumble or lie down and can't seem to get back up. It's easy to assume they're just tired or getting older, but sudden collapse can point to something far more dangerous: low blood sugar, internal bleeding heart arrhythmia, or even a neurological emergency. If your dog can't stand, especially if they seem confused, cold to the touch, or their breathing changes, don't wait. Lay them on their side. Keep them calm and warm, and call your vet right away. Time matters. If this happened after exercise or excitement, it may be exercise-induced collapse, which affects certain breeds like Labradors. If your dog has a history of fainting or brief paralysis, ask your vet about diagnostic testing and blood work. It could be the clue that saves their life. Dogs can't tell us when they're dizzy or feel faint. They just fall and hope we notice. But while collapse can be terrifying, there's another sign that's messier and sometimes dismissed as just a stomach bug. Number 4, vomiting or diarrhea with blood. More than just a stomach bug. Dogs vomit sometimes. It happens. But when there's blood involved in vomit or stool, it's time to stop guessing and act fast. Bright red blood can signal irritation in the stomach or intestines. But dark tar-like stool may mean internal bleeding, often from ulcers, toxins, or severe infections like parvo or hemorrhagic gastroenteritis. One common mistake: waiting just to see if it passes. With blood loss, every hour counts. If your dog vomits more than once in a day, especially with blood or lethargy, bring a stool sample and see your vet immediately. In the meantime, remove food for 12 hours, but never withhold water. Dehydration is what often tips these cases from bad to critical. Older dogs are especially vulnerable. Their systems don't bounce back like they used to. Gut issues aren't always dramatic, but when blood shows up, your dog's body is waving a red flag. And there's one final sign that could end everything in hours, not days. It starts with a swollen belly and ends in emergency surgery if you're lucky. Number 5, bloating or swollen abdomen, the hidden killer. It often starts after a big meal or playful run. Your dog suddenly looks uncomfortable. Their belly swells, they pace, try to vomit, but nothing comes out. They may drool, pant, or seem restless. This could be gastric dilatation volvulus or GDV, commonly known as bloat. It's not just gas. The stomach twists on itself, cutting off blood flow. And without immediate surgery, most dogs won't survive more than a few hours. Large, deep-chested breeds like Great Danes, German Shepherds, and Labradors are especially at risk. If your dog's belly feels tight and hard, they can't settle, and their gums look pale, skip the internet and go straight to the emergency vet. To reduce risk, avoid exercise for at least an hour after meals, feed smaller portions, and consider a gastropexy surgery if your breed is high risk. Bloat strikes without mercy, but it's preventable with awareness and timing. Now that you've learned these 5 signs, one question remains. Would you know what to do if one of them happened tonight? These 5 symptoms may seem small in the moment. A little cough, a pale gum, a bloated belly. But for your dog, they could be cries for help. The hardest part? Our dogs trust us completely, even when they're in pain. You don't need to be a vet, but knowing what to look for and acting quickly could mean the difference between a close call and a heartbreaking goodbye. Have you ever faced one of these signs with your dog? What happened, and what did you learn from it? Share your story in the comments. You never know who it might help, because sometimes a single detail is all it takes to save another dog's life. And if this video helped you feel more prepared, stay with us. There's so much more every dog owner should know, and we're just getting started.